Hello world, this is Dr. Rico, the root canal specialist to the stars, coming to you guys today, talking to you guys about some health points and dental health points dealing with root canals and tooth decay. So first question, are there any unusual causes of tooth decay and root canals that people don't know about? Absolutely. Number one, illicit drug use such as methamphetamine, such as cocaine. All those things can really affect your dental health and also affect you needing root canals. So methamphetamine, when someone's on methamphetamines, we call it meth mouth, it basically looks like childhood caries. So they have rampant caries all over. And when patients have these issues, we have to really look at trying to maintain their oral health by doing root canals, fillings, and sometimes it can be so far gone that we can't do anything but to extract. And unfortunately, we see a lot of young adults have what we call meth mouth because they are on these drugs. The other thing we see is trauma. Trauma can also cause patients to need root canals because it can also affect the nerve. Trauma, whether it's a car accident, biking accident, falling down, breaking a tooth, trauma is one of the number one leading causes to needing a root canal or having a tooth extracted. Another thing is bruxism, grinding your teeth. When you grit and grind your teeth, they can create these small microfractures inside the tooth, and these microfractures can cause that nerve to start becoming inflamed or infected, and you end up needing a root canal based on that. Another way that many people don't think about is stress. When you're stressed out, when most people are stressed, what do? They clench and grind their teeth, and when they do that, that also creates these microfractures in the enamel that can actually cause that nerve to become inflamed and needing a root canal. So what are some other things? Vaping. People think that vaping does not affect your gum and your tooth health. Well, it does. There's something in the vape called vape juice, and the vape juice actually brings the flavor to the vaping, and it has a chemical agent called propylene glycol. And that propylene glycol can attach to the tooth just like sugar can attach to your tooth, and actually it can erode your tooth and create an acid and cause your tooth to decay and need a root canal. Another thing is coffee. Like, Dr. Short, coffee? Yes. Coffee is another substance that we all enjoy drinking, most of us anyway, and it can actually have harmful effects on your teeth if you don't brush them properly. Why? It's because coffee has caffeine, and caffeine is an acid-like substance, and it can also break down the enamel in your tooth and create cavities, and once you have a deep enough cavity, you may end up needing a root canal. What about drinking juice? Drinking juice is healthy, but drinking juice in moderation, you have to make sure that you still brush your teeth. Why? Because juice contains sugars. Apple juice, grape juice, orange juice, they all contain sugar. So after you drink that freshly squeezed orange juice or grape juice or apple juice, you want to make sure you brush your teeth. If you can't brush your teeth, make sure you rinse your teeth very well. Rinse it with water if you can. If you have some, mouthwash, you can do that as well. What about energy drinks? I have a daughter that loves drinking Celsius, and these energy drinks, Celsius, you talk about, what's the other one? Red Bull, all those also contain sugar, and not only that, they also contain carbonation, which can break down your teeth as well. It can break down, and because it has sugar and acids, and it can break down the enamel and cause issues in your tooth.